The U.S. healthcare system is complex and constantly changing, and nursing practice evolves and changes accordingly. As a nurse, you face major challenges to prevent gaps in healthcare across healthcare settings, so individuals remain healthy in their homes and communities. Uninsured patients present a challenge to healthcare and nursing because they are more likely to skip or delay treatment for acute and chronic illnesses and die prematurely. Challenges to healthcare leaders today include reducing healthcare costs while maintaining high-quality care for patients, improving access and coverage for more people, and encouraging healthy behaviors. Healthcare providers are discharging patients sooner from hospitals, resulting in more patients needing nursing homes or home care. The healthcare system of the new millennium is less service-oriented and more business-oriented because of cost-saving initiatives, which often causes tension between the caring and business aspects of healthcare. National Priorities Partnership. The Institute of Medicine calls for a healthcare delivery system that is safe, effective, patient-centered, timely, efficient, and equitable. The National Priorities Partnership is a group of 52 organizations from a variety of healthcare disciplines that have joined together to work toward transforming healthcare with the aims of healthy people and healthy communities and better and affordable care. The group set the following national priorities: work with communities to promote wide use of best practice to enable healthy living and well-being, promote the most effective prevention, treatment, and intervention practices for the leading causes of mortality, starting with cardiovascular disease, ensure person and family-centered care, make care safer, promote effective communication and care coordination, make quality care affordable for individuals, families, employers, and governments. The Institute of Medicine's vision for the healthcare system of the future makes quality care accessible to all populations, focuses on wellness and disease prevention, improves health outcomes, and provides compassionate care across a person's lifespan. Nursing continues to lead the way in change and retention of values for patient care while meeting the challenges of new roles and responsibilities. According to the Institute of Medicine, nurses need to be transformed by 1. Practicing to the full extent of their education and training, 2. Achieving higher levels of education and training through an improved education system that provides seamless progression, 3. Becoming full partners with physicians and other healthcare providers in redesigning the healthcare system, and 4. Improving data collection and information infrastructure for effective workforce planning and policy making. Healthcare regulation and reform. As healthcare costs continue to rise out of control, regulatory and competitive approaches had to be instituted to control healthcare spending. The federal government, the biggest consumer of healthcare, which pays for Medicare and Medicaid, created professional standards review organizations to review the quality, quantity, and cost of hospital care. Medicare-qualified hospitals created physician-supervised utilization review committees to review admissions and identify and eliminate the overuse of diagnostic and treatment services ordered by physicians caring for patients on Medicare. The Prospective payment system was established in 1983 to eliminate cost-based reimbursement. Each diagnosis-related group has a fixed reimbursement amount with adjustments. Healthcare facilities, such as hospitals, began to receive a specific dollar amount instead of cost-based fees. Most healthcare providers now receive capitated payments. Capitation means that the providers receive a fixed amount per patient or enrollee of a healthcare plan. Resource utilization groups are utilized in long-term care settings. In all settings, Healthcare providers try to manage costs so the organizations remain profitable. Managed care describes healthcare systems in which a provider or healthcare system receives a predetermined capitated payment for each patient enrolled in the program. In 2011, the National Quality Forum revised and defined a list of 29 never events that are devastating and preventable. These never events are organized into 7 categories: 1. Surgical, 2. Product or device, 3. Patient protection, 4. Care management, 5. Environmental, 6. Radiological, and 7. Critical. The Patient Protection and Affordable Care Act, passed in 2010, focuses on the major goals of increasing access to healthcare services for all, reducing healthcare costs, and improving healthcare quality. As a professional registered nurse, it will be important for you to understand the basics of healthcare so you can assist your patients and be an advocate for them. Review Table 2:1, Examples of Healthcare Plans, as a supplement to this PowerPoint. The emphasis of the healthcare industry today is shifting from managing illness to managing health of a community and the environment. The Core Functions Project developed the Health Services Pyramid. The pyramid shows that population-based healthcare services provide the basis for preventive services. These services include primary, secondary, and tertiary healthcare. A wellness perspective focuses on the health of populations and the communities in which they live, rather than just on finding a cure for an individual's disease. Life expectancy for Americans has shown a steady increase over the past century. The reduction in mortality rates is credited to advancements in sanitation and prevention of infectious diseases, patient teaching, and injury prevention programs. Please review Box 2:1, Examples of Healthcare Services, as a supplement to this PowerPoint. Case Study: Amy Sue Riley is a 15-year-old white female of Irish descent. She is a freshman at a Catholic high school. Although her parents are divorced, Amy Sue reports that her family, consisting of 2 brothers that live with their mother, are very close, and that her parents work together to meet all their children's needs. Amy Sue has had asthma since she was 5 years old. She controls her asthma by taking oral medications and by using inhalers as needed. What concerns would you have if you were Amy Sue's school nurse about Amy Sue getting the medical care she needs? Possible concerns for the school nurse include: 1. Transferring medication to and from school. 2. Ensuring that Amy Sue keeps her inhalers with her when she visits her dad. And 3. Adjusting to a new routine in high school. Healthcare settings and services. The U.S. healthcare system has 5 levels of care for which healthcare providers offer services: disease prevention, health promotion, and primary, secondary, and tertiary healthcare. The healthcare settings within each of the levels include preventive, primary, secondary, tertiary, restorative, and continuing. Larger healthcare systems have integrated delivery networks that include a set of providers and services organized to deliver a continuum of care to a population of patients at a capitated cost in a particular setting. Nurses are especially important as patient advocates in maintaining continuity of care throughout the levels of care. Healthcare agencies seek accreditation and certification as a way to demonstrate quality and safety in the delivery of care and to evaluate the performance of the organization. Preventative and primary health. Preventive care focuses on reducing and controlling risk factors for disease through activities such as occupational health programs. Primary health care focuses on improved health outcomes for an entire population. It includes primary care and health education, proper nutrition, maternal and child health care, family planning, immunizations, and control of diseases. Primary health care requires collaboration among health professionals, healthcare leaders, and community members. Health promotion programs lower the overall costs of healthcare by reducing the incidence of disease, minimizing complications, and reducing the need to use more expensive healthcare resources. Some examples of primary care include health education, proper nutrition, maternal and child health care, family planning, immunizations, and control of diseases. Please review as a supplement to this PowerPoint, Table 2.2, Preventive and Primary Care Services. Secondary and tertiary care. Disease management is the most common and expensive service of a healthcare delivery system. Chronic illness causes disability, decreased quality of life, and increased healthcare costs. People who do not have healthcare insurance often wait longer before presenting for treatment, thus they are usually sicker and need more healthcare. As a result, secondary care and tertiary care, also called acute care, are more costly. Young adults turning 19 years of age are in danger of being uninsured because of the inability to attend college, instability with financial independence, and challenges finding employment with healthcare benefits. With the passage of the Patient Protection and Affordable Care Act in 2010, the number of young adults with either private health insurance coverage or employer-sponsored health insurance has increased. People in this age group are also less likely to see a doctor on a regular basis or to follow up on a problem if they do not have health insurance. Hospital emergency departments, urgent care centers, critical care units, and inpatient medical surgical units provide secondary and tertiary levels of care. Because of work redesign, more services are available on nursing units, thus minimizing the need to transfer and transport patients across multiple diagnostic and treatment settings. Discharge planning is a centralized, coordinated, multidisciplinary process that ensures that the patient has a plan for continuing care after leaving a healthcare agency. Discharge planning begins upon a patient's admission and continues throughout their stay. An intensive care unit is the most expensive healthcare delivery site because each nurse usually cares for only 1 or 2 patients at a time, and because patients in the ICU require complex treatments and procedures. Patients who suffer emotional and behavioral problems, such as depression, violent behavior, and eating disorders, often require special counseling and treatment in psychiatric facilities. The Balanced Budget Act of 1997 changed the designation for rural hospitals to critical access hospitals if certain criteria were met. Critical care hospitals provide inpatient care to acutely ill or injured people before transferring them to better-equipped facilities. Restorative care, with the emphasis on early discharge from hospitals, patients usually require some level of restorative care. Patients and families are more likely to follow treatment plans and achieve optimal functioning when they are involved in restorative care. Nursing is one service most patients use in home care. However, home care also includes medical and social services including physical, occupational, speech, and respiratory therapy, as well as nutritional therapy. Most important, nurses need to be aware of other areas that directly affect home health care. Services commonly provided by home health nurses include wound care, respiratory care, vital signs monitoring, elimination needs, nutrition, rehabilitation, medication administration and education, IV therapy, and laboratory studies. Specific elimination needs include ostomy, skin care, irrigation, insertion of catheters, peritoneal dialysis. Rehabilitation restores a person to the fullest physical, mental, social, vocational, and economic potential possible. Rehabilitation should begin the moment a patient enters a healthcare setting for treatment. Initially, rehabilitation usually focuses on preventing complications related to an illness or injury. As the condition stabilizes, it helps to maximize a patient's functioning and level of independence. Rehabilitation occurs in hospitals, drug rehabilitation centers, outpatient settings, and homes. An extended care facility provides intermediate medical, nursing, or custodial care for patients recovering from acute illness or those with chronic illnesses or disabilities. Extended care facilities include intermediate care and skilled nursing facilities. At one point, extended care facilities primarily cared for older adults. However, because hospitals discharge their patients sooner, there is a greater need for intermediate care settings for patients of all ages. An intermediate care or skilled nursing facility offers skilled care from a licensed nursing staff. Patients receive extensive supportive care until they are able to move back into the community or into residential care. Continuing care describes a variety of health, personal, and social services provided over a prolonged period. The need for continuing care is increasing because people are living longer. Many of these people do not have family or others to care for them. Continuing care is typically for people who are disabled, functionally dependent, or suffering a terminal disease. It is available within the institutional settings or in the home. Examples include nursing centers or facilities, assisted living, respite care, adult daycare centers, and hospice. A nursing center is a resident's temporary or permanent home, with surroundings made as home-like as possible. These centers provide 24-hour intermediate and custodial care to residents of any age with chronic or debilitating illnesses. Routine nursing care, rehabilitation, diet, social, recreational, and religious services are typically offered at these facilities. Nursing facilities succeed when they recognize residents as active participants and decision-makers in their care and life in institutional settings. Staff must complete the resident assessment instrument on all residents. The assessment consists of the minimum data set, resident assessment protocols, and utilization guidelines of each state. The collected information provides a national database for nursing facilities so policymakers will better understand the healthcare needs of the long-term care population. The minimum dataset is a rich resource for nurses in determining the best interventions to support the healthcare needs of this growing population. Review Box 2.2 Major regulatory requirements defined by the 1987 Omnibus Budget Reconciliation Act, and Box 2.3 Minimum data set and examples of resident assessment protocols as a supplement to this PowerPoint. As one of the fastest-growing industries within the United States, assisted living offers privacy, independence, and security. Services in an assisted living facility include laundry, assistance with meals and personal care, 24-hour oversight, and housekeeping. Some facilities provide assistance with medication administration, although nursing care services are not available directly. The national median monthly fee is $3,500 for a private unit. With no government fee caps and little regulation, assisted living is not always an option for individuals with limited financial resources. Respite care is short-term health services to dependent older adults either in their home or in an institutional setting. The family caregiver usually not only has the responsibility for providing care to a loved one but often has to maintain a full-time job, raise a family, and manage the routines of daily living. There are few formal respite care programs in the United States because of cost. Currently, Medicare does not cover respite care, and Medicaid has strict requirements for services and eligibility. Time for a quick quiz. A patient who needs nursing and rehabilitation following a stroke would most benefit from receiving care at A. Primary care center, B. Restorative care setting, C. Assisted living center, or D. Respite center. The answer is B. Restorative care setting. The goals of restorative care are to help individuals regain maximal functional status and enhance quality of life through promotion of independence and self-care. Adult daycare centers provide a variety of health and social services to specific patient populations who live alone or with family in the community. They may be associated with a hospital, nursing home, or may operate independently. Adult daycare centers allow patients to retain more independence by living at home, which reduces costs of healthcare. Nurses working in daycare centers provide continuity between care delivered in the home and that provided by the center. Hospice care is family-centered care that allows patients to live with comfort, independence, and dignity while easing the pains of terminal illness. Hospice care is typically provided to terminally ill patients who are expected to live 6 months or less. It focuses on palliative, not curative, care. Many hospice programs provide respite care, which is important in maintaining the health of the primary caregiver and family. Hospice care can be provided in the patient's home, an inpatient hospice unit, or a freestanding hospice home. The interdisciplinary team in the hospice works continuously with the patient's healthcare provider to develop and maintain a patient-directed individualized plan of care. Healthcare reform has stimulated the development of 2 models focused on coordinating medical care for patients and families. The first, Accountable Care Organizations, or ACOs, were developed to coordinate medical care by primary care and specialty physicians, hospitals, and other healthcare providers, with the goal of providing high-quality coordinated care. An ACO strives to ensure that patients receive the right care at the right time, without duplication of services or incidence of medical errors. Nurses are a key part of the ACO, acting as leaders and care coordinators. The second model of care developed to improve coordination of care is the Patient-Centered Medical Home, or PCMH. The goal of a PCMH is to make care for patients more efficient, effective, continuous, comprehensive, patient-centered, and coordinated. The PCMH uses technology, teamwork, and effective communication with patients to make care culturally sensitive and accessible, gather clinical data, promote patient participation in decision-making, and monitor patient outcomes. The primary care health provider functions as the hub of the PCMH. Case study: recently, Amy Sue has had some difficulty breathing, especially during gym class. Corinne is a 45-year-old African-American nurse who recently accepted a job as a school nurse for the 4 Catholic schools in the area. 3 of the schools are grade schools, and 1 is Amy Sue's high school. Before she took this job, Corinne worked at a pediatrician's office. How will Corinne's work experience help her assist Amy Sue to access the healthcare delivery system? Corinne can refer Amy Sue and her family to a pediatrician for follow-up. Corinne can use her experience as a pediatric nurse to assist with providing interventions and education to Amy Sue and her family. Corinne can provide valuable resources to Amy Sue and her family, such as the American Lung Association, lung.org, and pediatricasthma.org. Amy Sue's difficulty managing her asthma is significant for Corinne because Corinne's oldest daughter has asthma. Plus, because of her job in the pediatrician's office, Corinne has had experience with caring for children with asthma and with helping patients access the healthcare delivery system. Issues in healthcare delivery. Despite the large number of practicing nurses, a critical shortage of nurses is projected in the United States. The healthcare practitioner competencies are an excellent tool for measuring how well a nurse practices nursing and can serve as a guide for the development of a professional nursing career. In addressing the continued challenge facing the healthcare system, the Institute of Medicine identified 5 interrelated competencies that are essential for all healthcare workers in the 21st century. The Institute of Medicine also identified 10 important rules of performance for a healthcare system to follow to better meet patient needs. Quality healthcare is the degree to which health services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. Safety is a critical part of quality healthcare. Pay-for-performance programs and public reporting of hospital quality data are designed to promote quality, effective, and safe patient care by physicians and healthcare organizations. These programs are quality improvement strategies that reward excellence through financial incentive to motivate change to achieve measurable improvements. Every major healthcare organization measures certain aspects of patient satisfaction. The Hospital Consumer Assessment of Healthcare Providers and Systems, also known as HCAHPS, is a standardized survey developed to measure patient perceptions of their hospital experience, identifying patient and family expectations, knowledge, preferences, cultural beliefs, and values is an important part of patient-centered care. Please review Box 2-4. Institute of Medicine's Competencies for the 21st Century, Box 2-6, Evidence-Based Practice, End-of-Shift Reporting Practices and Patient Satisfaction, and Box 2-5, 10 Rules of Performance in a Redesigned Healthcare System, as a supplement to this PowerPoint. The American Nurses Credentialing Center established the Magnet Recognition Program to recognize healthcare organizations that achieve excellence in nursing practice. The revised Magnet model has 5 components that are affected by global issues that are challenging nursing today: transformational leadership, structural empowerment, exemplary professional practice, new knowledge, innovation, and improvements, and empirical quality results. Nursing-sensitive outcomes are patient outcomes and nursing workforce characteristics that are directly related to nursing care, such as changes in patients' symptom experiences, functional status, safety, psychological distress, registered nurse job satisfaction, total nursing hours per patient day, and costs. The American Nurses Association developed the National Database of Nursing Quality Indicators to measure and evaluate nursing-sensitive outcomes with the purpose of improving patient safety and quality care. Quality and safety education for nurses identified informatics as a competency for nurses. Nursing informatics uses information and technology to communicate, manage knowledge, mitigate error, and support decision-making. Nurses gain or use information when they organize, structure, or interpret data. Knowledge develops when nurses combine and identify relationships between different pieces of information. Technological advancements influence where and how nurses provide care to patients and can help nurses improve direct care processes, patient outcomes, and work environments. Technology makes your work easier, but it does not replace nursing judgment. Globalization, the increasing connectedness of the world's economy, culture, and technology, is one of the forces reshaping the healthcare delivery system. Children, women, and older adults are the vulnerable populations most threatened by urbanization. Please review Box 2-8, Nursing Quality Indicators, as a supplement to the PowerPoint. Time for a quick quiz. Technological advances in healthcare. A. Makes the nurse's job easier. B. Depersonalizes bedside patient care. C. Threatens the integrity of the healthcare industry. Or D. Does not replace sound personal judgment. The answer is D. Technology does not replace your critical eye and clinical judgment. In many ways, technology makes your work easier, but it does not replace nursing judgment. For example, it is your responsibility when managing a patient's IV therapy to monitor the infusion to be sure that it infuses on time and without complications. An electronic infusion device provides a constant rate of infusion, but you need to be sure that you calculate the rate correctly. Quality and performance improvement. Every healthcare organization gathers data on a number of health outcome measures as a way to gauge and improve its quality of care. Quality data are the outcome of both quality improvement and performance improvement initiatives. Quality improvement is an approach to the continuous study and improvement of the processes of providing healthcare services to meet the needs of patients and others and inform healthcare policy. Performance measurement analyzes what an institution does and how well it does it. In performance improvement, an organization analyzes and evaluates current performance and uses the results to develop focused improvement actions. Quality improvement data inform you about how processes work within an organization and thus offer information about how to make evidence-based practice changes. A well-organized quality improvement program focuses on processes or systems that contribute to patient, staff, or system outcomes. The quality improvement process begins at the staff level, where problems are defined by the staff. Unit quality improvement committees review activities or services considered to be most important in providing quality care to patients. To identify the greatest opportunity for improving quality, the committees consider activities that are high volume, high risk, and problem areas. Once a committee defines the problem, it applies a formal model for exploring and resolving quality concerns. There are many models for quality improvement and performance improvement, including Patient Self-Determination Act, Six Sigma or Lean, and Rapid Improvement Event. Once a quality improvement committee makes a practice change, it is important to communicate results to staff. Revision of policies and procedures, modification of standards of care, and implementation of new support services are examples of ways an organization responds. Change opens up opportunities for improvement. Healthcare delivery systems need to address the needs of the uninsured and the underserved. Healthcare organizations are striving to become better prepared to deal with these and other challenges in healthcare. The solutions necessary to improve the quality of healthcare depend largely on the active participation of nurses. Nurses need to remain knowledgeable and proactive about issues in the healthcare delivery system to provide quality patient care and positively affect health.